Hello, everyone, and welcome to this webinar on non-dietary solutions for IBS. My name is Alex Manos. I am one of the co-founders here at HealthPath, and I am a certified functional medicine practitioner with a background in nutritional therapy. So I have a master's in personalized nutrition. But I'm also a transformational breathwork facilitator intern. So I have a real interest in the role that breathwork can play within healing various chronic complex conditions. And I have my own personal journey with chronic gut issues. I was diagnosed with IBS when I was 18, having had digestive issues pretty much all of my life before then. But it was when I was 22, 23, starting my training in nutritional therapy, that I did my first SIBO test and found out that an underlying component to my diagnosis of IBS was actually small intestine bacterial overgrowth. And I spent a good chunk of my 20s then diving into the research around gut health and looking for my own solutions that would successfully deal with those chronic symptoms. And while diet and supplementation did play a key part, I actually found it was some of the other non-dietary interventions that had the biggest impact on alleviating those symptoms long term. So I'm really passionate about this topic. And from a personal perspective, I've really seen how these sorts of things can be incredibly helpful. So the objectives are very simple. We're essentially going to summarize evidence-based, non-dietary interventions. And this means that we're going to be talking around our circadian rhythm or circadian biology. We're going to talk about the role that breathing and different forms of breath work can play within improving IBS. And we're going to touch on exercise and movements. We'll discuss stress management and mindfulness, psychoeducation, and then psychodynamic psychotherapy. These are interventions that have been discussed in the research as being effective, with various international gastro organizations recommending them as a form of therapy for IBS. So 2 years ago now, there was a meta-analysis that was done, and the authors concluded that there is considerable evidence that an array of mind, body, and other psychological therapies can be effective complements to medical treatment. And in fact, I would go as far as to say that they can be effective alternative therapies to medical treatment. And there are potentially two core reasons why this might be the case. We see in the research, including this paper that also was published a couple of years ago, that in a good chunk of people that have a diagnosis of IBS, they seem to have a lower activity of the parasympathetic nervous system. Now, many of us know that the autonomic nervous system can be broken down into our sympathetic and our parasympathetic. The sympathetic often gets referred to as our fight or flight stress component, and the parasympathetic is that kind of rest and digest. It is the parasympathetic nervous system and the activity of this part of our nervous system that is really supporting healing, that's supporting regeneration of our cells. It's incredibly important, therefore, when we are looking to recover from something like IBS or SIBO or numerous other health conditions for that matter. Now, this activity within the autonomic nervous system can be monitored via something called heart rate variability, which we'll also touch on towards the end of today's webinar as well. And using various apps and gadgets and monitoring our heart rate variability can actually give us a really good insight into what might be one of the underlying imbalances that are driving and manifesting the symptoms that get clustered together to associate with IBS. But as well as an imbalance in the autonomic nervous system in regards to this parasympathetic sympathetic balance, we also see low vagal tone in those with inflammatory bowel disease and irritable bowel syndrome. And this low vagal tone actually starts to favor peripheral inflammation, which is something that we also frequently see in people with IBS. The vagus nerve is a nerve that goes from the base of our brain and goes down into our torso and innervates all of the organs within our torso. It has a key role to play within gut health, and activation of the vagus nerve through various interventions, which range from activating the gag reflex to gargling to meditation to certain strains of probiotic and other things. Activating the vagal nerve, activating the vagus nerve will provide, therefore, a calming and anti-inflammatory benefit. The vagus nerve is a core component of the gut-brain axis, which many of you will be familiar with. If you're not, there is a webinar on our YouTube page that really goes into detail on what the gut-brain axis is and various ways to support it. So, understanding that we see imbalances in our heart rate variability in our autonomic nervous system, as well as vagal tone, we can move back to the paper that we've already cited, and we can talk about the actual non-dietary interventions that can be considered. Meditation and relaxation, yoga, autogenic training, hypnotherapy, biofeedback, cognitive behavioral therapy, psychodynamic psychotherapy are all discussed within that meta-analysis from 2 years ago. However, while these are all incredibly helpful, and some have been shown in studies to be as effective as, for example, the low FODMAP diet, which I think is a fascinating consideration, I also want to add to this our circadian rhythm, the fact that we operate on a 24-hour body clock, exercise and breath work. These might not have randomized controlled trials behind them as such, but we see in the research and clinically that these have a profound impact on improving our health from numerous underlying issues. And I actually want to start with our circadian rhythm, our circadian biology, because for me, it is one of the absolute foundations to optimal health, including optimal gut health. And we have a webinar specifically on circadian rhythms, again, on our YouTube page. So if you want to learn more about this, then head over to our YouTube page, which is just Health Path. But I'm going to cover some of the key takeaway points in today's webinar. And that is that our physiology operates on a 24-ish hour clock. And that 24-hour clock is synchronized primarily to the light-dark cycle. If you think throughout our evolution, light has really dictated what we're able to do until artificial light obviously was created. So for the majority of our evolution, we woke when the sun rose and we started to reduce our activity as the sun set. And therefore, we are very much living, or should be living, seasonal lifestyles, getting a little bit more sleep in the winter months, a little bit less in the summer months. But that light from the sun, that full spectrum sunlight, is entering the eye. It's traveling to the master clock in the brain that is called the SCN for short. And the SCN, the master clock, is then sending a message throughout the body about what time of day it is. So our physiology is literally synchronized to the specific spectrum of light being emitted by the sun, which varies throughout the day. As well as having a master clock in the brain, though, we have peripheral clocks in its thought, all of our cells in the body. And these peripheral clocks are not only entrained to this 24-hour cycle via the master clock, but our sleep-wake cycle, physical activity, social time, and meals when we eat help create a healthy rhythm within these peripheral clocks. So put very crudely or simply, if you are a shift worker and you work nights, you are going to be receiving both a distorted light-dark cycle routine, but also a sleep-wake cycle and a mealtime cycle. So if you're eating your breakfast at 11 p.m., you're receiving one message via that meal time, and another one from what's going on from a light perspective. And that causes some degree of lack of synchronicity. It causes a bit of chaos, cellularly speaking, and that disrupts all of our physiology. Now, looking at this from another perspective, we also see that photobiomodulation, PPM written here, which is also sometimes referred to as low-level laser therapy. We can think about using infrared lamps, which are becoming increasingly popular. This has been shown in animal studies to significantly shift the gut microbiome. But we also see this sort of extrapolate into humans. So this paper published in 2018 in the World Journal of Gastroenterology really sums it up nicely in this table. So various life habits, whether you're a night worker or you eat late or you get to sleep late or you practice certainly intense exercise late in the evening, or if you're sort of meal timing or sleep timing is irregular, which for a lot of people it is. We might be going to bed at a reasonable hour Sunday night to Thursday night, but then maybe we go out on a Friday or Saturday night and we don't get to sleep till the early hours. Something that is called social jet lag, which has been shown to impact our health because of the impact it has within our circadian rhythm. Jet lag obviously is another very easy example that we can consider. So all of these things are influencing the clocks within our cells or brain. And look at the fourth column here. Most, if not all, of the digestive processes, ranging from the production of saliva through to digestive enzyme production and expression, but also the concept of leaky gut and gastric emptying, so food leaving the stomach and entering the small intestine. These are all regulated by our circadian rhythm, meaning that the gut should be most active during the day when it's supposedly getting its food, and it should be relatively, so to speak, inactive at night. Every physiological process has a peak activity which should be regulated by these lifestyle variables and light. When there is dysregulation in this, we can end up with IBS, IBD, and cancers of the digestive tract. So the foundation to improving our gut health is having a healthy circadian rhythm. And we'll touch on what that means practically in a little bit. Now, in humans, we see that photobiomodulation improves microbiome diversity. And that's if we have 3 sessions per week rather than 1. We also see changes to keystone species like Akkermansia, Bifidobacterium, and Faecalibacterium. If you've done one of our gut health tests, these are bacteria that are tested for. And Akkermansia has a lot of research behind it recently. It's almost a trendy bacteria. It's been associated with our metabolic health, meaning that there's a relationship between Akkermansia and blood sugar regulation, for example. But isn't it fascinating that essentially exposing ourselves to infrared light, which is emitted from the sun, but we can use infrared lamps as well, increases the number of keystone bacteria within our microbiomes. Food is one way that we can increase these organisms. Exercise might be another, but light is another as well. Infrared is at its sort of peak, at its greatest intensity at sunrise and sunset. Think about what the sky can look like on a clear day at those times. You can see a redness in the sky, and that's because of the infrared that is being emitted. So you can start to see straight away that actually getting outside or cracking a window open at sunrise and sunset, so you're exposing your eyes to that infrared light, is one of the most powerful ways to entrain a healthy circadian rhythm. We are essentially influenced by our light environment. But we also see that imbalances within our light environment can actually contribute to leaky gut. We see an increase in certain bacteria that have LPS on their surface. These bacteria are sometimes referred to as gram-negative bacteria, and they can be potentially pro-inflammatory, especially within the context of leaky gut. In mice with a disrupted sleep-wake cycle, meaning that most likely in the lab they were kept up when they should be sleeping, and therefore they slept when they should be awake and active, that led to a change in the microbiome where they saw an increase in these potentially pro-inflammatory bacteria and a decrease in the integrity of the gut lining. So when we think about trying to actually improve or maintain a healthy circadian rhythm, we really need to try and get outside and get a little bit of sunlight in the morning. It doesn't have to be a clear sky. This is even on a cloudy day, that full spectrum sunlight is still there, obviously. Bearing in mind that approximately, I think I'm right in saying 50-ish% of that full spectrum light from the sun is blocked through windows. Hence, we need to open the window, or we need to go into the garden and expose ourselves, expose our eyes to a little bit of morning sunshine, as close to sunrise as possible, but let's just say as earlier the better. Ultimately, I appreciate, certainly in the UK in the summer, most of us are not going to be getting outside at 4:40 when the sun might be rising. Think about the temperature of your bedroom. 17, 18 Celsius seems to be optimal for the best quality sleep. Limit caffeine and alcohol. Caffeine from probably around midday for a lot of people. Limit your alcohol consumption in the evenings. Limit your smoking if you're a smoker. Limit artificial light at night, often referred to as ALAN in the research. Artificial light is the light being emitted from your phone, your TV, the lamps that you're obviously going to have on at some point as well. So our technology, that light has been shown to inhibit our production of melatonin, which is not only one of our primary sleep hormones, but one of the most potent antioxidants and therefore components of our immune system as well. Melatonin in supplement form has very strong evidence behind it in improving various symptoms of things like reflux and GERD and IBS. So we don't necessarily need to supplement it. We can think about optimizing our light environment and our circadian rhythm to ensure that we are producing healthy, appropriate amounts of melatonin. And there's some interesting research showing us that if we just treat ourselves to some new sheets, a new pillow maybe, I appreciate it's not necessarily cheap, but a new mattress, these things can improve low back pain in people struggling with low back pain, and as a result can improve sleep. And then one of the other really big ones is, as we've mentioned, meal timing. So I'm a big advocate, as all nutritionists are, of time-restricted feeding, this idea of trying to eat within a maximum of a 12-hour window, meaning if you had breakfast at 8 a.m., you want to have finished your dinner by 8 p.m., and you don't want to be eating anything until the following day at 8 a.m. If you can shorten that even further, then brilliant, i.e. breakfast at 8 a.m., dinner at 6:30 p.m., for example. Because remember, that is another environmental stimuli. It's another trigger for a healthy circadian rhythm. We're not designed to eat at night, fundamentally. So this is the bread and butter of optimal gut health, but not just gut health, of optimal health. So we've mentioned that we probably shouldn't be doing intense exercise in the evenings if we want an optimal night's sleep and we want really good overall health, including gut health. However, appropriate amounts of exercise done at the appropriate time, which is going to be based on lots of different variables, admittedly, has been shown to increase microbiome diversity and the metabolic functioning of the bacteria, meaning that they're actually more active and fitter themselves. And the way I kind of put this to clients is the stronger and fitter you are, the stronger and fitter your bacteria are, because our bacteria are producing various metabolites, and those metabolites may be found in greater quantities in those who regularly exercise. Hence, I sort of talk about them being fitter themselves. Now, inappropriate amounts of exercise, whether that's because you're too sedentary or you're actually training too much, can be very problematic and can cause imbalances in the microbiome. In human studies has been shown to contribute to intestinal permeability, aka leaky gut, and as a result can promote inflammation and have negative impacts on our overall health. But interestingly, there's also a gut muscle axis that is discussed in the research. So again, this is, as is often the case with these axes, it's bidirectional. Our gut bacteria can influence distant organs, including our muscle, but our muscle has been described as an endocrine organ, a hormonal producing organ, and it modulates our immune system at the same time. So like the gut-brain axis is bidirectional, our gut is influencing our brain and our brain is influencing our gut, the gut-muscle axis is bidirectional. There's fascinating research on the health properties of muscle when it comes to various elements of health, ranging from our immune system to our central nervous system and the brain. And there's more than one good quality study showing us that yoga can be as effective as a low FODMAP diet in improving symptoms and quality of life in those with IBS. So this is kind of really strong evidence that food is not the be all and end all to improving your gut health. It's a component of it, but we don't want to put all of our eggs in one basket, because I see so many people get very focused on diets where it becomes they become a little bit hypervigilant, and it creates a lot of stress and anxiety, which then increases the likelihood that they're going to be reacting to maybe other foods as well. So we need to be mindful that yoga, partly because maybe it can help activate the vagus nerve and help balance our autonomic nervous system, has a significant impact on improving gut health. And in some of these studies, 3 45-minute classes is what was done over a 8-12 week period. So doing yoga 3 times a week for 45 minutes, after a couple of months, you may find that your symptoms are significantly better. And then we have mindfulness, meditation, and stress management. Now, obviously, to some degree, we could argue yoga and certain other forms of exercise can have a stress management component to them. But when we talk about meditation, we can think about 4 components of meditation: a quiet, distraction-free location, a comfortable posture, whatever that may be, something to focus our attention on. This could be a word, a phrase or mantra, an object like a candle, or bodily sensations. We could use the breath as an anchor, as a thing to focus on while we meditate. And then our mindset is really important here as well. An open mind, a beginner's mind, a curious mind, a non-judgmental mind, a mind that has compassion for ourselves and others. These are all really important, but I think it's also important to highlight a comfortable posture is all you need. I think when I was younger, I certainly found and had this belief that if I was to meditate, I had to be very upright, almost military-like, and I had to kind of sit through any discomfort ultimately. And while that is a well-known form of meditation, it doesn't have to be that way. You can do this slouching, you can do this in your bed, you can do this on your couch. Being comfortable is really important within this context. So we know that meditation can reduce stress and anxiety, which often can be high in those with IBS, but also we know can impact the digestive system as well. That relaxation response can actually alter genetic expression in a positive way. We see in those with IBS and IBD that certain pro-inflammatory genes are actually upregulated, they're turned on. And meditation and relaxation techniques are changing how our genes are being expressed, which is, again, I think just a fascinating thing to be considering. And as a result of this change in genetic expression, what we refer to as epigenetics, we see a reduction in inflammation when we meditate. So we have mindfulness-based meditation, we have gut-directed hypnotherapy. This has been shown to be incredibly effective at improving IBS. Cognitive behavioral therapy, and then mindfulness-based stress reduction. Some of these have been done in a group format, which I think can be really helpful. And also what I think is really interesting is symptoms or benefits of doing these things have been found to persist for at least 3 months after the training, showing us that it's not just a symptom management sort of technique. You're literally shifting physiology, you're changing genetic expression, and you're doing so enough that these things stick up to, well, plus 3 months later. That's a really important thing to consider. Something like the low FODMAP diet might not always have, and often doesn't have, that kind of long-lasting impact on its own. The low FODMAP diet is really around symptom management, but it's not dealing with the crux of it, which might be low vagal tone, it might be an imbalance in the autonomic nervous system, and that there could be lots of other reasons, obviously, as well. So we do have good quality studies showing us that hypnotherapy can be really helpful, either individual hypnotherapy, but also group hypnotherapy. So this is really something to consider if you're struggling with chronic IBS. If you can't access a hypnotherapist for whatever reason, there is an app called Nerva that we often recommend to our clients. And this is an evidence-based digital therapeutic gut-directed hypnotherapy app. It works on supporting the gut-brain axis. And I have seen clients come back to us and me reporting positively that they feel it's really helped. It doesn't help everyone, but nothing does. It's certainly worth a try if you haven't tried hypnotherapy yet. When I did this, which was probably 6 months ago, just so I had that personal experience with it, there was a 14-day free trial, which might still be there as well. So you can give it a go free of charge. I think for me then it was something like £50 for 3 months there afterwards. Now, I'm a huge advocate of breathwork. Again, we have various podcast episodes on our YouTube channel. I've also done a webinar that's on our YouTube channel specifically on breathwork and IBS. So if you're interested in this little section, then you can go over and see sort of a more detailed webinar just on this topic. But I liked this quote: "The interplay between an individual's breath dynamic and intestinal behavior is an unaddressed point in the physiopathology of IBS. And although we might not have hard evidence here yet, we just can mechanistically understand and have, I think, a confident understanding of the fact that if we're not breathing well, we can't really have optimal gut health either. And we'll see why that's the case in a little bit. But diaphragmatic breathing, or poor diaphragmatic breathing, has been associated with various symptoms around IBS: inflammation, pain, anxiety and depression, low back pain, TMJ dysfunction, so sort of jaw aches and pains and dysfunction, headaches, GERD or reflux. These are symptoms that are associated with IBS that also correlate with dysfunctional diaphragmatic breathing. Dysfunctional breathing may contribute to just stress. If we know in the research that the way you breathe is influencing your psycho-emotional state, you can create anxiety through breathing in a certain way. So if you're unintentionally breathing that way, that is also going to just mount a stress response. And what did we say at the beginning of the webinar? If you are in a kind of state of low level chronic stress, that is not conducive to healing. That is not conducive to regeneration and rejuvenating ourselves. And it is going to contribute potentially to IBS type symptoms. But if we're not breathing well, and if we're not diaphragmatically breathing, We can have poor blood and lymphatic flow. That could be poor blood flow to the digestive system, meaning that we're not going to be digesting and absorbing as well as we could be. It might impact peristalsis and digestion. If you think of your diaphragm, it's a dome-like shape that sits just underneath your rib cage. And as you breathe in, that dome flattens and is lowered. And this is why you should see when you breathe that your tummy rises and falls. Think of babies when they breathe. They're always the example of someone who's breathing really well. You can see a very obvious rise and fall of the tummy. And that's partly because of this movement of the diaphragm. But think of it, if this diaphragm is coming down, then coming up, it's kind of a massage of our internal organs. It's a massage of our intestines and maybe to some degree the liver and the pancreas and the gallbladder. And that's going to be helping with peristalsis. That's going to be helping calm and modulate the nervous system to ensure that we're digesting and absorbing our food as effectively as possible. And the authors of this paper went as far as saying, we wonder if a reduction in abdominal movement as a result of dysfunctional breathing and an increase in bracing, essentially holding tension within the abdominal area, is a risk factor for SIBO. And I would say that it absolutely is in my clinical experience and with my personal experience. I think a lot of us, for various reasons, are holding tension in various parts of our body. This can be because of traumas, this can be because of stresses, this can be because of low self-esteem. A very common, easy example would be someone who was sort of very self-conscious of how tall they were. This is the example that's often been given to me is a female. You know, if they're a young female who was very tall, who became a little bit self-conscious of this, who starts to slump a little bit, to be that little bit shorter. They didn't like to maybe stand out from the crowd, so to speak. And these postural habits can create tension in different parts of the body that can then impact us later in life. Or maybe we've had pain on and off in our abdomen for years. And when we're in pain in this tummy, what do? We again kind of slump over to try and protect that part of us. So we have to be thinking around the breath because it can also impact mechanics. Diaphragmatic breathing occurs when the diaphragm comes down and pushes on the abdominal content. As the abdomen expands, the pelvic floor relaxes and descends. This is also what should happen during a bowel movement as well. The opposite happens obviously with the exhale. So if we're not breathing right, we literally don't have the mechanics to allow the pelvic floor to relax and descend. I mean, a really personal example here is I believe that some of my digestive issues started from an accident I had at school when I was 5 years old. And to cut a long story short, it was very embarrassing. Some of the school saw because I had to walk back to the classroom, and essentially I had a bout of watery diarrhea that I didn't think I was going to have. I was going for a pee at the urinal, so it went all down my legs, and a teacher ended up sort of finding me and bathing me, and my mum came and picked me up. But there are two things from that quite traumatic experience when I was 5. One was mum told me later on that I refused to go for a poo at school ever again. And you can imagine what that means. It means every time I felt like going for a poo, I ignored that urge. And we know that if you do that regularly, you are going to retrain your body essentially not to poo. That is going to manifest in constipation. If you're chronically constipated, you're going to develop an imbalance in your microbiome. You're burdening the liver, and all sorts of things are going to start to go on and start to dysfunction. But the second thing is, as a result of that, I guess, really, I think I started to hold tension in my abdominal and bowel area. And it took me, I have to laugh about this, it took me the best part of 25 years to realize that when I was going for a bowel movement, often I could actually feel my anal sphincter contract. I wasn't able to have this coordinated muscular firing sequence when I was going for a poo. And that was manifesting as constipation, IBS, and essentially just struggling to clear my bowels. The interest in the role of the diaphragm muscle in the context of functional intestinal disorders, i.e. IBS, is justified by its autonomic dependent function and the fact that it's the only muscle whose movement affects the small and large bowel. So anatomically, it is critical for digestion. So some of you might be asking, what is diaphragmatic breathing? It's very simple. And I'm imagining that many of you are sitting as you listen or watch this webinar. So we will do this in a sitting position. But all I want you to do is, if you can, make sure you're breathing through your nose. You might want to place a hand in front of your belly, around your belly button. If you want to, you can place a hand on your chest as well. And I just want you to start breathing, or continue breathing, I should say. Don't think about changing it. Don't judge it. Just become aware of your breath. And I know that's hard to do. We kind of automatically, instantly start to change things because we know, or we maybe worry that we're not doing something right. But to the best of your ability, just feel what's happening for you as you have a couple of hands on your torso, one in your belly, one in your chest, and you breathe through your nose. Now, what we want to see or feel is that our tummy is rising up or out on the inhale and falling in on the exhale. And nothing much should be happening in our chest. But a good chunk of us only breathe into the chest. There's very little happening around the belly. So diaphragmatic breathing is ultimately ensuring that you're breathing through your nose and that you're breathing deep into your abdomen. So that hand on your belly, you can see, is rising and falling with the inhale and the exhale. Now, if you make the tempo of your breath one of 6 breaths per minute, meaning you're breathing in for 5 seconds and you're exhaling for 5 seconds with no pause between the inhale and the exhale, that frequency of breathing has been shown to activate the vagus nerve. It's what we call coherent breathing. And making sure that you're doing that 5-second inhale, 5-second exhale through the nose, making sure that hand is rising and falling, means that you are diaphragmatically breathing, and you're breathing at a rate that's going to be arguably most conducive to supporting your overall health and well-being. And if you were to continue with this for a little bit, as you maybe continue listening to this webinar, notice how you feel. And it's very likely that you feel a little calmer, that you might feel a little bit more present. If you wanted to, add in a little bit of gratitude into the mix. Can you think of someone or something that you are grateful for today? We know that gratitude practice also improves various parameters of our health. So it's a very easy, simple mindfulness meditation type exercise where you're using the breath. That's kind of your focus, that's your anchor. And then you're consciously generating some positive emotions like gratitude, love, or joy. And we know that this improves your heart rate variability that we mentioned earlier can be off in those with IBS. It's so simple, yet so effective if this is done consistently. What are you happy to do from this day onwards with it? Could you do 5 minutes a day? Could you do 10 minutes a day? If you could do 10, 15, 20 minutes a day, you will absolutely experience improvements in, I would say, your gut health, but your overall health within, let's say, 2, 3, 4 weeks tops. So I wanted to touch on one other thing around this, because we've just spoken around kind of the mechanics of breathing and of pooing to some degree. Dyssynergia is a diagnosis that sometimes people with chronic constipation can get. It affects up to 1/2 of patients with chronic constipation, and it's thought to be a behavioral problem. And this is really the example of that I just gave of me when I was 5, and there was a behavioral change as a result of a really embarrassing traumatic experience that impacted my ability to coordinate my abdominal and pelvic floor muscles. So it's thought that potentially during potty training, maybe we have again, an embarrassing or awkward or challenging time, something happens, which means our relationship to pooing kind of changes, put really simply. Biofeedback therapy is really helpful when someone has dyssynergia. And the easiest way I can describe this is that it would be seeing someone like a physiotherapist is relearning how to relax the pelvic floor as you inhale. But a very easy thing to consider doing is get yourself a squatty potty. You can get them off things like Amazon for 10, 12 pounds from memory. That puts you in an anatomically correct position to poo. And if you look at some of the reviews online, for some people, this really, really helps them have an easy to pass bowel movement. But then as you're sat there and you're having a poo, focus on your diaphragmatic breathing. Breathe in to your pelvic floor and exhale, and start to cultivate, that sort of relationship with the breath. It can really help over a period of time. It might not change things the next time you poo, although the squatty potty could, but the breathing and thinking around that sort of relaxation of your pelvic floor can be helpful. Now, autogenic training is actually something I wasn't really familiar with until I researched for this webinar, but put simply, it is a comprehensive relaxation technique, and we have very good quality evidence, a randomized controlled trial in this case from 2009, showing us that it can be useful for those with IBS. Psychodynamic psychotherapy, this is very much around intra and interpersonal conflicts. So relationships, either with ourselves or others, ultimately. And I've certainly seen over the years that the relationships we have with maybe our partners, family members, colleagues, ourselves, absolutely impact on how our digestive health and our overall health is going to manifest. It's actually recommended by the World Gastroenterology Organization. So, it's not saying that it's all in our heads, but a part of IBS can be in our heads. And I always kind of say that a little bit tongue in cheek, partly because of our gut-brain axis, but also because of our thoughts, our emotions, our belief systems. These impact our physical health and well-being. So psychodynamic psychotherapy can be helpful, I would say, for quite a lot of people with chronic digestive issues. And psychoeducation, I'm a big advocate of. I think as a nutritional therapist and functional medicine practitioner, this is something that as an industry, I think we do really well. And that's partly because often we have much more time with our clients compared to other professionals, especially GPs. And this is really around an understanding and knowledge of the condition, of the symptoms. And if you can understand what can cause IBS, it can so help us manage the situation. If you understand that it's not necessarily that there is, a parasite, an infection, an overgrowth that's driving all of those symptoms, but actually it can be a dysfunctional gut-brain axis. It can be poor communication going on. It can be related to an imbalance in your nervous system or poor vagal tone. And those things require the sorts of interventions we've been discussing. You can't go onto a restrictive diet and improve your autonomic nervous system. You can't go onto a restrictive diet and improve your vagal tone necessarily. So we need these other tools. And I think the better we can understand what's going on, the more personalized and specific and appropriate the recommendations can be. And this is why testing can be helpful, because it can help give you a bit of an understanding that, okay, well, you do have SIBO, or you do have an overgrowth of methane producing organisms. And that is something that we need to address a bit through diet and supplementation or medication. But let's not forget that that could be going on alongside some of the things that we've discussed today that are so common in those with chronic functional conditions, whether it's IBS, CFS, fibromyalgia, and many other conditions for that matter. You know, I often in clinic talk about the studies showing us that if you take a group of people with IBS and a group without IBS, you insert a balloon into the bowel and you inflate the balloon to the same level. Those with IBS feel like it's been inflated to a greater level, put very simply, showing us that there is this hypersensitivity in the bowel of people with IBS. So again, it's not in your head, but it is partly in the head because of that gut-brain communication. There is an almost excess communication, or let's call it an imbalance in communication, whereby we're more aware of that sensation. And that is something that can be improved upon. But again, that's where things like hypnotherapy and mindfulness practices and meditation can help rebalance the underlying issue. And I don't necessarily think that probiotics or herbal antimicrobials are always going to successfully deal with that long term. So we've got all of these things that can be considered that really aren't dietary or supplement interventions. So which of these have you tried and which of these haven't you tried? If you haven't tried any, what are you most leaning towards? What would you like to try first? Some are going to be easier than others. Some of us will resonate with some more than others, etc. But I think hopefully you've got a lot of tools now within your toolkit, apart from the dietary and supplement side of things, that can help you on your journey. Now, I wanted to just kind of mention a few devices that sort of connect with what we've talked about today. So we spoke about photobiomodulation, we spoke about our light environment, and we spoke about infrared lamps. So red light therapy, we saw in the research, we cited it, we showed you the papers, has shown to increase microbiome diversity. It increases keystone species like Akkermansia and Faecalibacterium. It improves energy, it improves sleep, it improves skin, it has an anti-inflammatory benefit. And the product that I recommend is from the company EMR Tech. You can go to their website and we have a code, HealthPath20, that will give you 20% off the cost of their products. There's also Sensate, which is a device that is often used, I'm going to kind of say, within the stress management world, but it works on the vagus nerve, and therefore it can be helpful for those with IBS and gut issues if you know or suspect that maybe the vagus nerve is involved. So you can go to get Sensate, and the code HealthPath20 will also get you, it'll get you £20 off, I think, from memory, rather than 20%. HeartMath. HeartMath is a system that teaches you how to self-regulate, and it comes with technology that allows you to essentially monitor live your heart rate variability. And therefore it helps get you into what they call a coherent state. I actually recorded a podcast with HeartMath yesterday that will be released onto our YouTube channel and onto our podcast, which summarizes in a lot more detail, obviously, what HeartMath is and how it works. But ultimately, it is a set of techniques that help you establish coherence, meaning that your physiology is in a coherent state. The vagus nerve has been activated in the sense that it will provide an anti-inflammatory benefit. And HealthPath 10 will give you 10% off their products. And then we also spoke about the artificial light at night being emitted from all of our technology, which can be really problematic to our overall health. And one of the things that I recommend to all of my clients is to get themselves a pair of blue light blocking glasses. I don't have any with me at the moment, but they are just glasses. They normally have an orange or red tint to them to block out the light being emitted from your TV or iPad or laptop or phone, meaning that you're not going to get the same suppression in melatonin that you would if you were using your technology without them. Blockbluelight.co.uk is our favorite brand, and Health Path 10 gets you 10% off their products. So hopefully that helps in regards to how you can go about doing some of these things that we have discussed. So thank you for listening, everyone. I hope this has been helpful. I hope it's given you some different options and tools that you can go away and explore. If you have any questions, and obviously do reach out to us if you're watching this on our YouTube page, then obviously leave us a comment as well. But thank you for listening, and hopefully we'll be back next year with our next webinar, which is going to be on resiliency.